Your 2021 Heroes Among Us healthcare category recipients, Haleigh Pagel of Sumner, Whitney Schmidt of Reedland, and Matt Sowle of Plainfield.
It was a normal busy day at the clinic. Both Haleigh and I were seeing patients.
Definitely short-staffed, so I was helping out on the floor versus my clinic supervising role. Working on site with two other nurses. I accepted a phone call that morning because Carol, our receptionist, had transferred it back to myself as Mom was noting shortness of breath as a chief complaint. I talked to Mom. She had relayed that she called the local urgent care and there was an hour wait, and so she was wondering if she could come and bring baby over right away.
As soon as I walked in, it was clear that the patient was having a hard time breathing. Typically, if a child comes in with respiratory distress, you need to act on it right away because they can go down quick. Everybody just kind of came in to help at that point. We called for an ambulance. The nurses just started bringing stuff into the room, bringing oxygen in. We got the nebulizer going, so the breathing treatment. Matt came into the room to help and just got everything going for that baby.
I called the ambulance. They had noted that they were going to send somebody over right away. I informed baby, pulse was elevated, 70, 74, oxygen level, and that we need somebody to head over right away. And so it seemed like it was taking a long time waiting on the ambulance.
The ambulance arrived and they didn't have paramedics. And when Matt found out they were about 10 minutes away yet, he immediately said, "Let's go."
Initial thoughts were, holy smokes, what are we gonna do? And then I just told Mom, let's go. So we just grabbed the baby and out in the ambulance we went, told the EMT that was there, you're driving, I'm in the back. So you just kind of switch into you're relying on your training and what you need to do next, thinking your next steps ahead. If something worsens, if the child worsens, what's the next step to do? And so we're in the back and the EMT showed us where all of the nebulizer equipment was we needed and the medications, the albuterol. We hooked him up to straight oxygen with the breathing treatment and we headed for Allen. We just got out of the ambulance, took the baby and headed right into the emergency room. At first they had no idea why we were carrying a baby in, but then we told them what was going on and they acted very quickly.
That decision making was a little scary because Shelby Schmidt, the other clinic nurse, also hopped in the back of the ambulance to attend. So it left me and another clinic nurse and then Haleigh to see all of Haleigh's patients and all of Matt's patients at that time, both of which were very busy schedules.
We had a clinic full of patients in the waiting room, and the nurses and I just did what we could to get them all seen.
People weren't designating certain things, but just going and being action focused. I think the teamwork was something that I haven't necessarily seen before, just all coming together and working to figure out what's best for baby and how can we help. Taking it all in and kind of assessing the situation, putting all the factors together, actually realizing how special of a moment it was when we were all there together to help, to see the patients at hand and then also to help baby as well. Very
flabbergasted, very honored, very proud of how we all acted that day and how we performed.
Very humbling. Very, very proud to work at the clinic that I work at in Trappola because it truly was a team effort.
Your 2021 Healthcare Heroes Among Us, Haleigh Pagel, Whitney Schmidt, and Matt Sowle.